Q open. Audio up.
Carol, make sure the phone guests are standing by. 8,
Flying graphic.
7,
Camera 2, I'm going to be coming to you
five,
first. Stand by to Q mark.
4, 3, 2.
And Q mark.
Anyway, there's some good news on the RU-486 front, believe it or not. You know, we've had situations in the past where women have called us that have had laminaria inserted for a multi-day procedure.
Late-term abortion.
Late-term abortion procedure, second or third trimester. They have to do laminaria insertions to expand the cervix enough to get the large instruments in to kill the baby. That have changed their mind. They'll go home that night and they'll feel their baby kick, or whatever happens, and they'll change their mind. And they'll call the abortion clinic back and say, "I've changed my mind. Is it too late?" 100% of the time, they'll be told it's too late. Mm-hmm. That the baby's already dead or the baby's been injured. You know, you can't change your mind once the laminaria is inserted. And we started getting doctors around the country. We had one right here in Dallas who has since died, who developed a reputation for being able to remove the laminaria and deliver later on a perfectly healthy baby with no problems. Mm-hmm. That was always considered kind of unlikely in the case of RU-486. But now we have doctors that are actually having women that are taking RU-486, and these doctors are able to reverse the procedure. We've got one of them joining us today, Dr. Matthew Harrison. Hello, Dr. Harrison.
Hello, how are you today?
Well, we're just fine, and I want to thank you for joining us, sir.
Yeah, thanks for having me.
Yes. Now, my understanding is you've had some experience with this issue of reversing the effects of RU-486. Is that correct?
Yes, it is.
How does that work?
So RU-486 is a medication that blocks progesterone receptors. So it mimics progesterone, it recognizes the receptor in the woman's body, and then it attaches to that receptor, but then it does not allow at the cellular level, does not allow the woman's body to function as it's supposed to. So it's kind of like if you have a lock and you have a key that'll fit in it, but it will not turn the lock and unlock it. So RU-486, when it's given to a woman, blocks the progesterone receptors. The placenta then is essentially starved from nutrition. The woman's body thinks it's going through progesterone withdrawal, which is essentially what happens when a woman has a period, a menstrual cycle. And the placenta just sloughs away, and the baby is robbed of nutrition, and then dies and comes out as an abortion.
Okay, and how are you able to reverse that once it's begun?
So in 2006, I had a woman, a young lady that came to me and said that she had just taken RU-486 about 36 hours prior to that. And so I really had no idea what to do, because this is not the type of thing they train you in medical school. So I literally told her I need to step out of my office and pray and try to figure out if there's anything we can do. And so I started thinking about how RU-486. I went through that process of receptor blocking in my mind, and we were already doing progesterone supplementation in our office for fertility treatments. My partner at the time had training with Dr. Thomas Hilgers from Nebraska at the Pope Paul VI Institute on fertility treatments with progesterone. So we had progesterone injectable in our office. So I told the young lady, I said, "Look, I don't know if this will work or not, but if we give your body a bunch of good keys in place of the bad keys that the abortionist has given you, maybe we can outcompete the RU-486 and give you a bunch of good progesterone that hopefully then will allow those receptors to work properly." So she agreed, and she was desperate, and she said she didn't care what happened to her. She just wanted to do whatever she could to save her baby.
Wow.
So I gave her 200 milligrams of progesterone injection, and that was on a Friday. So that weekend, she actually started bleeding, so we thought we were losing the baby. She went to the emergency room, got an ultrasound, got to see the baby's heartbeat for the first time, because they did not allow her to see it in the abortion clinic. And and the ER doctor, fortunately, said, go home and, hope for the best. So she came back into my office Monday. We were able to confirm a heartbeat. The baby was still living. She stopped bleeding, and we continued with progesterone supplementation up through about 28 weeks of pregnancy.
Wow.
And then she delivered a perfectly normal, healthy baby girl at 40 weeks and a day.
Oh.
And now that little girl is 8 years old and just doing fantastic.
Wow.
Praise
How many other experiences have you had where you've been able to reverse?
So since that time, Dr. George Delgado and Mary Davenport in San Diego, they are connected to the Culture of Life Family Services Clinic. They have been compiling different cases of RU46 reversals. And so in 2012, December of 2012, in the Annals of Pharmacotherapy, they published 6 case studies of women that had reversals performed. 4 of those babies lived, 2 died. And so ever since then, we've been collecting data, and to this point, we've confirmed 91 babies that have been born healthy without side effects, and we have about 50 more that are currently in the protocol. We've developed a abortion pill reversal kit that's available to medical clinics and medical pregnancy crisis centers, and we would love to even get them on mobile units that are sitting outside of abortion clinics. We find that a lot of women, it's a lot of the same mentality that we see in patients that have essentially tried to commit suicide because they're desperate. They feel like they don't have a choice. They attempt suicide and then immediately regret it. And we see the same type of kind of psychological thing happening with these women who are in desperate situations. Maybe are being forced to go to an abortion clinic, and immediately they regret it and want to do something about it. So I think an ideal place to have these reversal kits available would be right outside the abortion clinic in ultrasound units where we can start the therapy just as soon as possible. And there's been concern because, as you know, when these women take the RE46, they immediately, when they do regret it, they immediately go back to their abortion provider,
Right.
and who says there's nothing that can be done. The babies will be developing improperly. They will be mentally slow or something. So they use these scare tactics to kind of frighten women into thinking that, they need to go ahead and finish off what they started. And but we have seen absolutely no adverse side effects. We use bioidentical progesterone, and we use it in doses that are physiologically normal doses, and so we have not seen any side effects from any of the treatments that we've given.
Let me ask you something, Dr. Harrison. Do you think the fact that the abortion industry is giving this drug in third dosages for what it was supposed to be given in, 600 milligrams was how it's approved by the FDA, and they're doing it in 200s.
Right.
Does that increase the chances that you can reverse it?
Oh, absolutely. And the other thing is that, as you know, they are also it's FDA approved up to 7 weeks, but we are seeing abortion clinics using it up into the 9 and even 10-week pregnancy stage. We definitely find that the later a woman is given the RU46 during her pregnancy, the better the chances are of reversing it.
So if she's given it late and only given a third dosage, which is what they're doing,
right,
then you're going to have a pretty high success rate in reversing this.
Yes, it does seem that way.
Wow.
And of course, the second part of their procedure is to take cytotec.
Right.
Right.
And if they have not taken the cytotec, then of course the baby, hopefully, the woman will not be going into labor and trying to expel the baby. So,
Dr. Harrison, how long does this whole procedure take? What is the window that y'all have for actually reversing it?
well, we're finding that first of all, it's best if they haven't taken the cytotec yet. But there are a couple women who have taken cytotec and still been able to have a baby. But really within the first 72 hours, the earlier the better.
And how much is this kit? How much does this kit cost? Does it need to be prescribed by a physician?
So the kits that we've developed, and they're available at the website abortionpillreversal.com, but we send out the kits for free. And the kits just really have all the information, the paperwork, the protocols. They have consent forms. They have HIPAA, the healthcare mandate forms for sharing information from doctors so that we can try to get information from abortion clinics. It has everything in there, including the disposables for the injections, the bandages, and all that. What will cost a little bit of money is the actual progesterone, and that has to be prescribed locally because of interstate commerce laws. We cannot ship a medication like progesterone to an unidentified patient. So, because these are progesterone needs to be in the office and ready to be used as soon as the patient walks in, and so we prefer it being gotten from a compounding pharmacy. But some of the progesterone, most progesterone, is actually available at local pharmacies at a 50 milligram per ml dose, and those vials are not very expensive. So, you're probably talking about maybe $200 for all the progesterone that's needed for the treatment, for the full treatment.
That's pretty cheap to
No,
save
it's
a
to
baby.
save a baby, but still you're going to need to find a local physician that's going to prescribe the progesterone. So even if you have a van sitting out in front of the abortion clinic, you're going to have an on-site physician willing to make the prescription and do the injection.
Right, and so right now we have about 220 physicians across the country that are stationed and ready to deliver the progesterone. We're getting more crisis pregnancy centers involved that can at least start the procedure. And we have had reversals in 11 countries and in 34 states.
Nice.
Wow. Well, this would be a good way for a physician who says, look, I'm busy, I've got a practice going, I don't have time to do anything for the pro-life movement, but I'd like to do something pro-life. This would be a perfect way for him to use his training and his expertise and his knowledge in the pro-life movement.
Absolutely.
You remember I told you a moment ago about this Dr. McCarty here in Dallas that was local OBGYN, hardcore pro-life, really good guy. And that's what he told me one time. He was helping out with the removal of laminaria, and he had babies he had one particular baby, I remember, that the abortion clinic in Dallas had told the girl her baby was already dead.
Yeah.
So not only could you not reverse it, but the baby was already dead from the insertion of laminaria, which they know good and well is an out-and-out lie. The laminaria does not touch the baby. It's in the cervix. But anyway, they had told her that, and Dr. McCarty was able to reverse it. But he told me one time, he said, I am so happy to do this, and he wasn't charging anything. He said, I'm so happy to do this because it's a way that I can use what God gave me to help save these babies. He said, I can't go out here and protest. I can't go to jail. I can't get beat up by the police. I can't do all those things, but I can do this.
Yeah.
Right, it's really exciting to be a part of. I've been fortunate to be involved in 2 laminaria reversals, and those women are really, really excited, to see those babies come to term and deliver. And then something else we're looking into now is methotrexate reversals. So leucovorin is a medication that's been used when people that are getting cancer treatments become too toxic from methotrexate. And so it essentially reverses methotrexate effects on the cellular level. And so we see that methotrexate has been used in abortions, and so this might be another avenue for us to be able to reverse even a methotrexate abortion.
Wow. Well, I think obviously the greatest gift here is the fact that a baby can be saved for a relatively small amount of money. And actually, it wouldn't matter if it was $1 million. It's the baby's life is worth more than whatever amount of money it would be. But also,
well, I think what physicians need to think about is, all of us have been trained in this kind of culture of death medical field that we, accept defeat, we accept what the medical industry is telling us. But when a person comes in and they've been, shot in the emergency room, we don't just throw up our hands and walk away and say, oh, well, there's nothing we can do. You know, we try to do whatever we can to help that mother, help that baby. And so it really is just kind of a different perspective on life.
Yeah.
And that's what I was trained to do, was to save life and preserve life and respect life. And so I think that other doctors need to understand that, you know, when someone comes to you in a desperate situation, we need to listen to the patient, try to see if there's a way that we can help in any way possible.
Right. It is amazing what can be done if you just don't accept defeat up front. Just say, well, nothing can be done. So,
and the medical community is catching up, and medical science is catching up to the abortion industry. I mean, we see this in all the fetal imaging that we have now that's being used to promote life. And I think it's really going to go a long way towards personhood identification.
Right. Well, you know what's interesting? We're seeing it now with this RU46 reversals, and we've seen it before in the laminaria removal and the baby surviving. These babies try desperately to live. I mean, by all rights, most of the things that the abortion industry does should kill them, but they fight to live. I mean, I guess it's just innate, and it's just part of their physical being that they fight to live, even at that early stage of their lives. It's amazing. Well, Dr. Harrison, I want to thank you for what you're doing. This is just another aspect of the pro-life movement, and I think it needs to get more attention, because I don't think a whole lot of people, even in the pro-life movement, know that this is happening. And I suspect that a lot of people would tell a woman, well, darling, you've already taken that RU46. You know, it's probably too late to do anything about that.
And I appreciate you having me. And just, you know, if we can point people to the website, they have an 800 number for women to be able to call and get immediate help. And any time, day or night, we have nurses and medical staff that are staffing those phone lines and can find, wherever they are geographically, find a doctor close to them, so that they can get this reversal underway.
Well, we're going to put your website up on the screen, and give us that 800 number.
All right. It is 877-558-0333.
And that's a toll-free number.
It is a toll-free number, and that's abortionpillreversal.com.
Okay, we're going to put that information up on the screen so people can have it, because I think this is kind of a hidden subject
that's great.
in the pro-life movement. I don't think a lot of people really know about it.
Right.
And, you know, for people
we just had a conference with the American Academy of Pro-Life OBGYNs in Washington, D.C. About less than a month ago, and a lot of them were very excited about a lot of this news.
I think it's really neat that one of the things the abortion industry is doing to make more money, which is thirding the dosage of RU46, is the thing that makes the baby survivable.
Right, right. They're doing us a favor.
Well, and you're right. I mean, they're looking for repeat business.
Absolutely.
So they're looking for people to come in for a surgical abortion so they can add that on top of the medical abortion.
Yeah, one of the things in this new book I'm writing, one of the things I'm saying we ought to propose as legislation is legislation that says if you do an RU46 abortion and it doesn't take, you have to do the follow-up procedure at no charge. Why should that woman be charged twice? But they're getting two bites of the apple here, with the abortion industry.
Yeah. Well, and the precedent's been set for that. I mean, I'm a hospitalist. I'm in the hospital all day long. I'm here right now. And if we have a patient that has heart failure and we send them out and they come back a week later, then Medicare dings the doctors and dings the hospitals.
Yeah, it's called, what's a global surgical fee or something like that?
Yeah, they're starting to essentially charge per patient, almost a capitation model, where it's not fee for service anymore, it's capitation. So, but the precedent's been set for that, and I think that might be some legislation that somebody should look into.
Yeah, I'm writing it up in this book, that I'm saying this is something we need to be looking at, is requiring these people, if you're going to go out here and knowingly increase the chances that this RU46 is not going to work, and at the same time you're putting this woman's life at risk if she starts to hemorrhage, which like this girl we had the other day, why should you then profit from the second abortion? Why should you make money off of that?
Well, right now our data shows that our numbers are about 60% reversal rate. Now, a lot of it's probably a bit higher than that because we've lost some people to follow up. In other words, they start
Right.
the procedure and then they just don't follow up, and they probably do okay and have the babies, but we just can't confirm it. But what's interesting is that when they've interviewed some of the OB/GYN doctors and the people from Planned Parenthood about this reversal, their attitude is, oh, well, we don't know if the babies would be fine if we did nothing, rather than trying to reverse it. I mean, my answer to that is, then why do you charge a woman $300 for something that only works 40% of the time?
Yeah, and you're saying it may do nothing. Do you tell the woman up front, give me $300 or $500 or whatever it is, but it may do nothing? Do you tell her that up front?
Exactly.
And that should be another disclosure type thing that they should have to go through. But anyway, we're applying standards to ethical people in an environment that has no ethics whatsoever, or they wouldn't be there to begin with. So
That's right.
it's kind of a moot argument. Well, Dr. Harrison, thank you for joining us today, and I really want to applaud you for what you're doing.
And thank you for all your work.
Thank you, sir. Bye-bye.
All right, bye-bye.
It's just amazing. We can always find, if we look around the pro-life movement, we talked about it a million times around here, some of the neat things that people do.
Yeah.
And there's always hope. I remember a few years ago when people were saying, pro-lifers were saying, well, once they get this abortion pill, it's all over. We don't have any.
I remember that. It was 20-something years ago.
Right. Yeah, once they get this going, we're done. Well, we're not done.
We're not done.
We're still fighting, and things like this are pretty cool.
I think it's a testament to removing the crisis of a crisis pregnancy. Like you said, it's almost comparable to a suicide situation where suddenly when the crisis is gone and she thinks that an abortion's happened, she starts thinking logically and thinking, this isn't me, this isn't what I want, I wouldn't do this to my own child. And the fact that now she has that option, which have you seen a billboard? I believe I've seen a billboard with the abortion pill reversal website on it. And so I think that's really cool that we're getting the word out to women because, yeah, they have no clue. So whether it's a matter of being out there on the sidewalk with the sonogram bus so that we can say, come in, it's not over, we have other options for you. Once that fog of panic is gone from the woman's mind, it's a huge step for the pro-life movement.
Oh, yeah. Unfortunately, we're out of time. Thanks for being with us, and don't ever forget, Life Dynamics is not here to put up a good fight. We're here to win, because winning is how the killing is going to stop. We'll see you in May.